I'm at Ponte Vedra Vein Institute. We are talking with Dr. Megan Deacon-Casey and nurse practitioner Michaela Demain. Thank you for joining us, or thanks for letting us be here with you.
Of course, thank you for having us.
I'm excited to learn about what you guys do here. But first, let's talk about beauty through the decades. So as people say, you know, you go through your 20s, your 30s, your 40s, you should switch up your skincare routine. Why is that, and what should we be doing?
Definitely. I think everyone should think about their skincare routine from as early as their 20s. We often neglect our skin. We spend a lot of time in the sun, but it's really important to start to protect, especially in our 20s. That's where we're not really correcting anything. We're kind of preventing. So the biggest part of it is make sure that you have a good cleanser and definitely SPF. And then if you move on to the 30s, what's happening there is that we're starting to lose some collagen even as early as our 30s. So you want to start to do things that's going to improve or increase your collagen production, such as like microneedling, radio frequency energy, any kind of energy-based devices such as lasers are very, very good. And then on your skincare routine, of course, never forget your sunscreen. Don't hang out in the sun. Of course, hydration and definitely protecting your skin. And as we move into the 40s, which we consider mature skin, we want to make sure that we're correcting, because you start to see fine lines and wrinkles. You start to see sagging skin show up. So you want to definitely add anything that's going to boost the collagen. You want to add retinol as well, because that helps to turn over your skin, so you get to see, you shed the dead skin, and then you get to see the nice, glowing, beautiful skin underneath. So those are the things definitely you want to make sure that you add to your regimen for taking care of your skin.
Okay, and we hear a lot about Botox and Dysport, which also breaks down into the neurotoxins and the neuromodulators. Can you explain what that is exactly?
Of course. So neurotoxins, aka neuromodulators, they're actually muscle relaxants. So what happens when we age, we start to notice fine lines and wrinkles show up. And what that does, the neuromodulators such as Botox and or Dysport, what they do is that they partially paralyzes those muscles, so then you don't form those lines anymore, especially across your forehead, crow's feet, glabella, that 11s that everyone talks about. So you want to make sure that even in your 30s, you're starting to add that to your regimen to make sure that you're not forming those deep set lines that it's harder to take care of once they set in.
And Michaela, you say that there are many uses for Botox and Dysport, not just facial wrinkles.
There are. As Dr. Deacon-Casey was mentioning, the most common things patients are asking for are to treat those number 11 lines, the horizontal lines across the forehead as well, and the lines around the eyes, referred to as the crow's feet. But there's so many other uses and indications that sometimes patients are excited about when we educate them. So we can use Botox or Dysport in the masseter muscles to treat TMJ or jaw clenching pain. We can do what's called a lip flip, where we put just a little bit in the upper border of the top lip, and that helps with fine lines and wrinkles there. We can treat a condition called hyperhidrosis, which is excessive sweating through the underarms, hands, and feet. We can help with tension headaches. We can even do something called a Nefertiti neck lift, which is treating these bands here in the neck, which allows the jowls to lift up a little bit. And lastly, we can treat the muscles that sometimes cause us to have an involuntary frown. So smoothing and relaxing these muscles here allows the corners of the lips to elevate slightly. The next question patients have all the time is, how many units will I need? In terms of Dysport, that could be anywhere from 50 to 150 units, depending on the areas you'd like treated. With Botox, it could be about half that, so 20 to 75 units. How will you know? You'll come see us for a complimentary consultation, and we can develop a personalized treatment plan just for you in the areas that you desire treatment.
All right, and speaking of that, you have a special for our viewers?
We do. We have a few specials going on I'm excited to tell you about. So the first one is buy 50 units of Botox and get 12 units free. Then we have an amazing Dysport VIP membership, which is you purchase a 300 unit vial of Dysport for $999 plus $99 registration fee. After you've used the 300 units in the vial, which most patients can use those 300 units through the course of a year. But if you require additional treatment, any extra units will just be $3 a unit.
Ooh.
Additional benefits is $100 off every dermal filler through the course of the year, and 15% off of skincare products and skincare services through the course of a year.
So how can people get in touch?
Okay, to take advantage of any of these specials, you can give us a call at 904-280-0600.
All right, well, it was so nice to meet both of you. And if you'd like to see this segment again or get more information, go to firstcoastliving.net.